A very good evening to all our viewers and welcome to this week's first edition of the Evening Review. My name is Toiwan Jabela, your host. Let's have a look at today's front page of Namibian Sun. So much is going on in our country right now, and you just saw on the front page there, Bloody Drunk Weekend. That is the headline about just how people continue to behave in the country despite the advent of COVID-19. But in this regard, tonight on the show we are joined by Dr. Chris Hikuam. He is the operations manager at Nampath Laboratories, that is a medical laboratory here in Windhoek. Of course, they have branches all over the country, and he will be telling us just about how much pressure the entire system, not only from hospitals and everywhere else, but also from laboratories, the challenges they are facing as we confront this pandemic together as a country. Chris, good evening and welcome to the show.
Thank you, sir, and good day, viewers.
Wonderful. Tell us first and foremost, Doctor, the kind of work that your company does, especially in the context of COVID-19.
All right. No, so Nampath Laboratory, it's a clinical pathology laboratory or medical laboratory service that we are providing in Namibia. And due to the third wave that was coming up for COVID-19, we've agreed to open a COVID testing laboratory where we conduct PCR testing as well as rapid testing. So before, post, pre the COVID, the third wave of COVID, our clients were mostly travelers as well as people like patients who wanted to know their COVID status. However, when the third wave arrived, we supporting government with testing of patients at the various sites, mostly in Windhoek.
Mm-hmm. And Doctor, with the third wave in particular, everything in our country has come under severe pressure. The hospitals, the suppliers of different relief solutions to COVID-19. How is pressure in the space of that you operate in, and particularly your company?
Yes, for laboratories, the pressure has been very immense from COVID. So typically, as we were supporting other sites, like we would receive samples from these sites, then we had to process those samples and conduct the PCR tests, and then report back to the sites on a daily basis, but also to the Ministry of Health team, so that our data can be included into the daily stats that the Ministry of Health provides. So we've been facing a lot of pressure from like during the third wave. It was quite expected. We knew the third wave would be more problematic than the first two waves. And then when we started receiving samples from the Ministry of Health, it was really a huge pressure on the people as well as the infrastructure of our laboratories.
Mm-hmm.
So, I mean, if I look at, I don't know if you've got specific questions or whether I should go into the different aspects that I'm talking about.
Please proceed, Doctor.
All right. So, for example, I mean, as you are aware, or as you might be aware, the laboratories are using medical laboratory scientists or medical technologists who are specialized health professionals that work in the laboratory. So before any result is given out, a PCR test is conducted, and the PCR test will give a positive or negative result. So it's a very sophisticated techniques that are used in this laboratory, and therefore we require specialized and highly trained professionals in the healthcare sphere. So during the time when we started receiving COVID samples for the third wave, because I mean normally in other normal circumstances we would be doing, say, on average between 30 and 50 tests per day. And so by the time the third wave hit from around the 11th of June, we were receiving plus minus 500 samples a day from the various sites. So you can really imagine, I mean, how the workflow will. So typically with the technologist, we had two technologists that were working at our laboratory, and we had to increase the number of technologists. And I mean, they are not really easy to find because it's mostly, I mean, it's NAST. It's mostly graduating or giving out, students on a yearly basis, and they are mostly absorbed in the other clinical pathology laboratories. So to get medical laboratory scientists was one of the challenges. So we had to increase capacity with that. Then, we had to also increase our reagents that we're using or that we are using for this test. We had to look at, challenges, other infrastructural challenges that we faced were, for example, the software that we use for data capturing and resulting is highly dependent on internet connectivity. And when these numbers increased significantly, we experienced problems with our network, for example. Then we had to now get additional routers in and, to increase the internet speeds at our laboratory. Further than that, to print out results, we had printer issues, because the printer that we had couldn't carry the capacity of, all of a sudden from 50 samples a day, I mean, we are going at 500, and the printing is going nonstop, and the printer that we had also gave in. And so we had to get an additional one. And then further than that, once the delay started developing within, from the sites, which was mostly driven, I mean, in my opinion, mostly driven by employers expecting employees to come back to work with a negative result. And these employees would, nonstop call people who are already overburdened with and who are focusing on, people who are interventions, as well as, bodies that need to be collected from mortuaries for funerals, and they require COVID testing. We also experience quite a lot of trouble with employees trying to go back to, their employers or to their places of work, and they were required to come back with a negative result. So those are just, I mean, in a summary, the challenges that we're experiencing.
Indeed. Doctor, tell me about also for a layman out there who's watching tonight, the last week, for example, there was a day, I don't know, I can't recall what day, where the country reported 71 deaths, COVID-related deaths, and people started analyzing when did this death occur, and some of the deaths date back to quite a number of weeks prior to the day of reporting. What does that say in relation to the backlogs and the capacity and the pressure that people like yourselves are under to produce those results timely?
Yes, with regards to, I cannot really speak to the deaths, the reporting of deaths. We can speak to the daily reporting of new cases.
Yeah.
So with these cases, yes, there is quite a backlog. As I said, I mean, the numbers have significantly increased, and the systems that were built or that were kind of like that were in existence are struggling to keep up with the workload. So with regards to the new cases, the backlogs are really causing the new cases to come out, a few days after they are really new cases. So, for example, if the backlog, if there's a 2-day backlog, then the results of today will only be incorporated into the statistics on Wednesday. So, in fact, today we've tested, say 100 people. We found 100 new cases. So the report, or today we collected 100 samples, and then we only give out the results by Wednesday. So the samples that are collected today will only be reflected on Wednesday when we give out the results, or in fact on Thursday when our results are incorporated into the Ministry of Health's database. So yes, the backlogs affect the true picture of what's happening out there.
Indeed, Doctor. And because our economy is so dependent on countries like South Africa for some of your products that you use in your laboratories, how has that process been? Having to procure certain things abroad, and there is so many protocols along the way. When people are trying to deliver those items here, then you have to stop maybe at the borders, and then you have to go through processes as a driver, for example. By the time you reach Windhoek, you are likely to find a gap in supply, isn't it?
Yes, there are issues. I mean, we are importing, as you know, we are importing most of our raw materials or consumables from South Africa. And so, they would also face, it's like a vicious cycle. They would face challenges, the courier services, number one, because they also have to get tested before they cross over. Then, I mean, the courier services can also be hit by COVID infections at their workplace. And customs, once again, I mean, if the courier service is sorted and the samples come, or the reagents come to the customs before they are cleared to come into Namibia, there can also be challenges at that end, and those challenges can be also due to, the people working at the customs being infected by like with COVID, so they have to be isolated, and not coming to work. So they also face capacity issues. So it's like it's a snowballing effect that we are seeing. When a service that you are expecting to be able to give a quick turnaround time for the patients and for the clients here is affected by COVID directly, where their capacity is limited because of COVID infection at their workplace. I'll even, like, apart from the reagents, I'll talk about the printer issue that we bought. And so the printer that we bought, it took a while for it to come through. Obviously, on the other side, from suppliers in South Africa, there was quite a bit of delay. Delay could be attributed to COVID situation in the country as well. And then it comes, and there's a delay again at customs. In the meantime, we were asking the suppliers of the printer to assist us with fixing, or support on fixing the printer, so we can keep on printing to give out the results to the clients. And they also had capacity issues because some of their people seem to be quarantined or isolated because they tested positive, so they couldn't come to work. So again, it's really a vicious cycle, where the effects of COVID are also delaying the services that we are receiving in order to give our patients. But I mean, that perspective is not really generally seen by patients. I mean, they from the patient side and from the client side, they are seeing, I mean, we've sent you the sample, and we want our result. That's it. Whatever effects are coming from the different suppliers of reagents, as well as, the infrastructure that we require, to conduct the tests, are not taken into consideration.
And I suppose also then that that operations like yours are also not spared from the advent of COVID infections itself. I mean, you would have some of your staff members also getting infected and then having to go home and or probably a number of them at the company, and maybe the company would have even to close for a day or two to fumigate and clear up the place. I mean, have you had such situations, even if it's not a lot?
Fortunately, we didn't experience that, but it's something that we plan for. For example, we would look at also, like, not only for the COVID lab, but in general, in our workplace, we had to go back to two where you want to work, one group coming in the morning and the other group come in the afternoon, because you are also looking at, I mean, what if there is somebody test positive, then it'll be better for you to lose one shift than to lose all your staff. So one has to make planning towards that. But I mean, the direct influences that we had from COVID on our staff was, for example, the staff members were overwhelmed, not only by the samples that they're getting, but from the calls, for example, that were coming, and that is like direct pressure from the communities that were coming through onto the staff members. Then we had, for example, instances where, staff members would have sick people at home, not directly staying with them at home, but relatives. I mean, if for example, in my case, my father tested positive, he was admitted in hospital. So while I'm running around making sure that we meet deadlines for reporting, I still have to now go and fetch my father to the hospital, like go and see to, like, he's got a problem in the hospital. They'll call me in to come and resolve that issue with him. And similarly, other colleagues of mine also experience the same things, or in the middle of the third wave and the note, we would be sitting with funerals that we have to attend, because it's people who are directly related to us or direct family that we have to arrange those funerals. So it was, I mean, there was a direct effect from COVID on the workforce.
Yes, and but amidst all these challenges, Doctor, you would agree with me that I mean, I saw someone the other day saying that there are two industries or so that are making money right now because of the situation, and that is ICT, like you and I communicating right now, not both in the studio because we want to social distance. So someone has to provide those IT solutions in order for this kind of communication to take place. Another one is the medical space with all its subsectors like laboratories and everything like that. Would you say that it has been, amidst all these challenges that you've been, business has been good?
I don't know if I can say the business has been good. Yes, we processed, as I said beforehand, we are running between 30 and 50 samples a day. And with COVID, I mean, we had to run at some point 400 to 500 samples a day, which means that, it's revenue that's increasing for the business. However, I mean, looking at the challenges that I also provided, earlier, it's that we had to also, invest quite a bit to accommodate the third wave or the increased numbers, like the internet solutions that we had to bring in, the printers that we had to replace to get bigger ones. It's been, infrastructure, we had to increase that, the staff we had to increase as well. So is increasing, but so are the expenses that we are incurring on this. But I mean, when you look at, from a health professional's perspective, it's really about servicing, our people and making sure that people get isolated ASAP, and then dealing with people who need to be buried to give us those results ASAP. So yes, I mean the workload has increased, or the revenue stream has increased, but so were the expenses that also come with the increased generation of revenue.
Yeah. The final question to you, Doctor, is around the issue of, again, you just spoke about the massive investments that we had to make in the business in order to be able to accommodate the increased pressure that came with the advent of COVID-19. But I just wanted to ask you, Doctor, whether you can also agree then to say that by the time COVID-19 is gone, institutions like yours would even have a better capacity because of they'll be left in a better shape now because you have expanded your operations, you have expanded business, if you like. COVID is leaving back a trail of better businesses in terms of capacity, isn't it?
Yes, capacity will be in terms of, that we will be able to conduct the testing. I mean, we will have capable cadres of colleagues that can do the work, and that we can, if there's a fourth wave, fifth wave, there will be people with experience who can actually step up and assist government with it. So definitely from that perspective, there is the capacity. The reality is also, this wave is over, for example, the printers that we bought will not be, they will not be utilized as they were supposed to be utilized, or as it is utilized during this period. We will, buying or investing into bigger equipment. Then you get this equipment that you are doing, say, 400 tests per day worth, in comparison to the 50 before. And then once the wave is down, then you're sitting with, a big machine, with huge capacity, and you cannot really utilize it. But the reality of it is, you are right about it. I mean, the capacity will be there to take up, challenges going forward, and so we should be thankful for that.
Chris, thank you very much for joining us tonight on the show. We appreciate your time.
Thank you for the opportunity to also, share with the viewers, the kind of challenges that we are experiencing, and I'm also hoping that, once people understand the kind of, operations that are going on in the background, and I mean that it's a systems issue, and not, just a laboratory that is delaying, giving out, that people can be more, understanding and hopefully, be more supportive, and similarly we are seeing in other countries how people are not, praising their healthcare workers for the efforts they put in. And I hope that our people, our public, our nation can learn from such examples and try and emulate them, or even, improve on them, and show, more appreciation to the healthcare workers who are really, working very, long hours to be able to give out results at the soonest possible opportunity. So thank you for the opportunity to also, share that.
Thank you, Doctor. Thank you for your time. We appreciate it.
All right. No, thanks, sir. Keep well.
Keep well.
Bye-bye.